A 28-year-old pregnant woman endocervical carcinoma. Definition: cervical cancer is widely could be to be one of the important malignancies in pregnancy. However, the epidemiology of both cervical cancer and pregnancy are changing. In most Western countries with organized screening, the incidence of cervical cancer has dropped dramatically in the last 20 years. Application in medicine. Symptoms and signs of cervical carcinoma in pregnancy are dependent upon the clinical stage and lesion size. In two series, all pregnant patients with stage IA and 60% of those with stage IB carcinoma were asymptomatic at time of diagnosis and had their disease detected by routine cancer screening. Patients with IB disease present with abnormal vaginal bleeding or discharge, pelvic pain, side leg pain, flat pain, chronic anemia, and shortness of breath. Since many of these symptoms are similar to those associated with normal pregnancy, the diagnosis of cervical cancer may be delayed in the pregnant woman. Advantage and disadvantage. Pros. Recent studies suggest no increase in maternal radiation complication rates among pregnant patients over non-pregnant patients, reflecting the advent of newer radiation techniques and the avoidance of combining surgical procedures with radiation. Cons. There is a 40% risk of mental retardation when delivering between 8 and 15-week gestation. After 20 to 25-week gestation, radiation may damage the fetal bone marrow, liver, and kidneys, and may increase risk of the intrauterine growth.
On rare occasions, cancer coincides with pregnancy. Because the medicines and radiation used for treating cancer can be dangerous to a fetus, a pregnant woman and her doctors must weigh a number of factors when planning her care, including the fetus's gestational age, the type and location of the cancer, how advanced the cancer is, how rapidly the cancer is developing, whether she has other health problems. In non-pregnant women, surgery may be used to remove cancer, depending on the cancer's type and location. After surgery to remove cancer, radiation, chemotherapy, or a combination of the two may be used to kill any remaining cancer cells. When treating a pregnant woman, doctors adjust the usual treatment regimen with the following in mind. 1. Radiation therapy for cancer treatment is not usually used during pregnancy because it can be harmful to the baby. Diagnostic tests that use radiation may be used during pregnancy if necessary. But ultrasound and magnetic resonance imaging, MRI, are considered safer and are used whenever possible. Chemotherapy medicines are not usually used during the first trimester because of the risks to the ETUs, but there are some that may be safely given in the second and third trimesters of pregnancy. Whenever possible, doctors try to delay chemotherapy during pregnancy to minimize the effects on the fetus. Such decisions depend on how advanced the cancer is and how quickly it is developing. If cancer is diagnosed in the third trimester, it may be possible to first deliver the baby, then start treatment. Once the fetus's lungs are mature, as confirmed by amniocentesis, an early cesarean or induced delivery can shorten the wait till treatment. If cancer is diagnosed in the first or second trimester, your doctors may try to delay chemotherapy as long into the second trimester as possible.
Conclusion. Conclusion. In the conclusion, the frequency with which cervical cancer complicates pregnancy must be borne in mind to facilitate its early detection and effective management. Management is determined by the stage of disease, gestational age, and patient choice regarding definitive treatment. The risk and benefit of treatment option, delay in therapy, and the necessity of good follow-up must be thoroughly discussed with the patient.
Hi, I'm Dr. Premlata, working as a senior consultant in OBG in Sanjeevani Hospital, Mahalakshmi Layout, Bangalore. One can still continue with pregnancy even if the cervical smear shows abnormal cells. As I said earlier, the cervical cancer takes long time to develop into a full-fledged cancer because the lesion, whatever smear is detecting, it is at a very early age. That's the advantage of doing a pap smear. And if at all, if there are abnormal cell, then we divide it into three categories, CIN1, CIN2 and CIN3. CIN is cervical intraepithelial neoplasia. So just that epithelium, whether it is invaded 1/3, 2/3 or the whole length of the epithelium, in that way the CIN 1, 2, 3 are categorized. So CIN 1 and 2 are relatively safer, there should not be any fear at all. CIN 3 we should be worried, but in any case, if there is abnormal cell found on pap smear, we would be further confirming it by doing a colposcope and a directed biopsy. And depending on the biopsy results, the patient would be advised what to do next. So unless 3 to 6 months we can give and repeat pap smear if biopsy is not proving anything, or if biopsy is proving CA in situ, then accordingly we can decide what further treatment should be advised to pregnant women. So usually in the later part of the pregnancy, we advise women to continue with the pregnancy and then go for detailed testing and go for the surgery or whatever treatment is advised. Yeah, if there are any abnormal changes in the smear, which is CIN3 or CIN situ, then the simple surgical procedures can also be advised in pregnant women, like cervical conization or LEEP procedure. So those are the simple procedures can have as a short day care admission, and the person can still think of continuing with the pregnancy. It's a mutual agreement, like how patient wants to go about it and how convenient is for them and to the doctor. So it is mutually on their comfort level.